I'm so happy to have an amazing guest with me today, media expert extraordinaire. And I can't even tell you how much this person has just changed my life and changed my world, especially because I have had an opportunity to do so much media lately. And so that's kind of what brought me to wanting to have this conversation and do this interview with Petrania, because of the fact that I'm realizing now why it's so important to have healthcare professionals in the media. So without further ado, I'm going to go ahead and let Petrania introduce herself and tell us a little bit about her background and how she came to where she is right now, and her company, and the fact that I have been one of her clients.
Hi there. Thank you so much, Christina. And thank you so much for joining in on this conversation. So just a little bit about me. I am a former news reporter and anchor. I was in the television news business for many years, over 20 years. So I've always done broadcasting. And just in the last year, 6 months actually, I started my own media consulting company. So I'm basically using the skills that I had as a journalist, and now I do more corporate storytelling and also media coaching. So working with people like Christina, professionals in different fields, and kind of bring out the best of what they do. Christina is a public health expert, so she's a medical expert. And so as a reporter, I know as a journalist, we're always looking for medical experts for our stories. You just never know what you cover day to day. And of course, right now, we know it's all about the coronavirus. People are talking about it. People are concerned about it. So we need kind of that medical voice, that expert in terms of what to do and where are we in, the fight against this pandemic right now. So, when I started working with Christina a few months ago, this was not the situation. And, we were just preparing her for talking about just a variety of medical issues. And now this came up. So, it just kind of goes to show as a media trainer and media coach that you just always have to be prepared, right, Christina? Like you just never know what's going to happen, what kind of situations you're going to be put in, and just that importance of being prepared and being ready to kind of talk about what you do, share your knowledge with the world, what your brand is all about, what your company is all about, and be able to kind of share that on an immediate basis. So, I'm just glad that I was able to help Christina, just in time for her. As Christina's been just kind of the face of this in terms of local news, just being able to go out there and just share her information and share facts, which I think is the most important thing. So the content, she's, the expert. I'm just kind of helping her in terms of, communicating her message clearly, efficiently, what people want to hear, and, just things like that, because that kind of all adds up to the, that kind of information highway, right? People are always looking, who's the person talking here, and is she bringing that message out clearly? And obviously, Christina has been doing well on that front. So that's a little bit about me and what I do. And, I'm just glad that I'm able to help people like Christina in a situation like this.
Wonderful. Thank you so much for kind of giving that background. So I'm going to just go ahead and start asking you some questions. So I'm going to have you put your reporter hat on for just a second. So as somebody who, was looking for content, because I know that that's, different, a little bit different than, somebody, saying that they're an expert and then, wanting to portray that to others, right? So if you're looking for content as a reporter, what are you looking for as far as what we can do as healthcare professionals to best help you with your story? So that's one of the things that I've really realized is it's not just the fact that I have an expertise in public health, but that I am very flexible in order to make sure that the message that I'm able to give meets the message of what the reporter's story is that they're trying to accomplish for that particular segment. So I don't know if you want to talk about kind of like best practices and things that you look for when you have a subject that is really easiest to work with, if that makes any sense.
Right. So I think it comes down to, as a journalist, we're always looking for content, right? For news relevance. And so, whatever we're reporting on the day, of course, it has to be news of the day, whatever's relevant. So for example, right now, of course, coronavirus is the news of the day. Everybody's talking about this. Everybody's concerned. It impacts the public, and people want more information. So obviously that is the content we're looking for, just all kinds of information about that. For, another example, if, on a regular time, it's flu season, for example, as a reporter, we want to do a story about the flu and who's impacted, how effective is the current flu vaccine, for example, so we're looking for anything that's relevant. So if you're a health professional and you're looking to, get the message out to the media or to talk in the media about a certain subject, you kind of have to think about what is relevant right now. What is, the reporter going to be looking for? So basically what the reporter is looking for is what kind of news stories that the public wants to hear about right now. We're not talking about something from 2 months in the past or 20 years. We want to talk about what's now and what's coming up. So that's kind of important to think about in terms of content that the media is looking for. We want to see a story that is impacting as many people as possible, what's out there. And that's why it's newsworthy and that's why it's relevant. So if you're trying to come up with content that the media might want or might need, then that's kind of a good start to think about that.
Kind of going back to that old standard of like the who, what, why, where, and when, and those kinds of, aspects to the story. I think one of the things that we talked about when we were like back before any of the, the COVID-19 coverage was even really ramping up, was looking at sort of what things were going on related to healthcare in relation to that month. So one of the things that we talked about, and one of my passions is sex trafficking and human trafficking. And so January was human trafficking month. And so I remember you and I were kind of working on a pitch for that back in January. So again, going back to relevant content and content that is timely, I think is really important. So if you are a healthcare professional that is looking to kind of maybe try to start doing more media or try to do more healthcare media contributing, what are some of the things that you think would be kind of ways for them to either break in or, things that they can do to prepare themselves? And, obviously in this virtual world right now, pretty much everybody needs to be comfortable on camera. Like it's just no longer something that you can't do anymore, right? I'm also, in addition to being a healthcare professional, I'm also a teacher, just like yourself. And you had your virtual classroom today, which was awesome. You had people from all over, as far as Toronto, I believe you said. And then I had my student pharmacists streaming their presentation for their, for their rotations to my practice site from the comfort of their own home. So we just all need to get comfortable being on camera just for our daily jobs, in addition to the fact that I think that media training and being media savvy and being able to create that content is really important. So what are some of the best practices you think healthcare professionals should know about?
Yeah, I think, when we started talking, you reached out to me, one of the first questions you had was, how do I even get in touch with these reporters, or get my content and my information and my brand out there to them? And I think you just have to be strategic, you just have to kind of know, first of all, know your expertise, like really get to know yourself. And you can say you're a doctor, but what kind of doctor? What's your expertise? What do you specialize on? So when you actually sell your message or try to sell your message to the media, say, hey, I'm an expert in this, you can give them a very specific, angle, because a lot of times we're looking for a specific expert for a specific story. So if you fit that, then they're going to be wanting to talk to you. So I think the first key thing is really know who you are, what your brand is, what your expertise is. So first of all, start with that. And then start reaching out, to local media. And that's kind of like the easiest way to do that. And as a media trainer, what I do, and I talk to my clients about it, is how you actually get around doing that. Because a lot of people have no idea to how even the media works, how they get their stories, how they get their content. So I kind of share that with you and with my other clients, just ways to get in touch with different reporters. And I think what you can do to kind of plan and prepare yourself to work with a media trainer or with a PR agency or something like that is to kind of list your expertise, what kind of subject you're comfortable talking about, for example, and maybe list, like you talk about relevance and what's newsworthy, maybe each month of the year, if, kind of list what kind of like medical anniversary it is, if it's like, a flu awareness month, or like you said, like a sexual human trafficking awareness month, something like that. And if you have an expertise to talk about something in that subject, put a list, put a note on your calendar. It's like, hey, this month is coming up. Maybe I should reach out to, particular news channel and say, hey, if you need an expert to come in and talk about this, I can help you. So it's about building a plan and just kind of looking kind of forward in terms of what's happening in the world and how your voice can be beneficial, to people out there watching, because it all comes down to what kind of good information you can put out there that's useful for the viewers, for the readers, and for the people listening on the podcast, or for example. So, I go out looking for information that's useful for me. Most of the time people just, listen for fun or entertainment, but for you have really good, useful, factual information. So make sure you're reaching out to the right people to get that information out. So I think that's kind of a good start of getting to that route.
Yeah, and one thing I will say, and I've noticed this a lot, is that people are actually really, they really want to help, right? So like one of the things that I did for like one of the very first news stories that I did is I contacted you and I was like, I have no idea what questions they're going to ask me. What should I do? And you told me, call up the station and ask for the producer for that particular segment and email them all the questions that you think are relevant, that you would like to have asked of you, and send them, references and resources. And that honestly was like one of the best advice that I ever got from you, because I showed up, I was camera ready. I made sure that I wore something that was easily mic'd, because that's always a challenge when you get to studio. And when I got there, like, first thing that they told me was, wow, you know what, we really appreciate how prepared you are for this interview. And we really appreciated you sending me those questions in advance, because it really helped us be able to craft the story. So I definitely think that was phenomenal advice. And anyone out there that is thinking about doing any kind of media contributing, I would highly recommend hiring a coach. If you think that this is something that you're going to want to do on a regular basis. All right, so great advice. I really appreciate, all of your counsel and your direction, because this is really uncharted territory. And one of the things that I like a lot about how our relationship is that you're very conscious of the fact that I have a healthcare mind and not a media mind, right? So I think that, if you're wanting to transition to something like this, or if you're just a healthcare professional that wants to see better content out there because you're seeing, either misinformation or the story maybe being turned in a way that isn't quite accurate, I think that this is a great option for healthcare professionals.
Yeah, and I think, more of what I help people with, because I know you guys have the information, you have the facts. I think sometimes it gets lost in translation just because of, maybe you're not communicating it the way as easy as easily as people can understand it. You know what I mean? And what I can help you with is to get those facts and information out and communicate it very kind of more effectively, more like everyday conversation and not medical terms. You know what I mean? Because I think most people want that information, but they want it from someone who they feel comfortable with and someone they can relate to. And once they kind of feel comfortable maybe watching you, just because, you're trained to think, okay, I need to talk to people like they're my friend, they're my parent, they're my grandparent, not just like a stranger wanting medical information, So if you're thinking and changing your thinking and thinking that way, your information will come out a lot more relatable, and I think that's what I try to help people with, is to speak like a normal person. As a journalist, when I interview people, the worst thing I can find is someone who just wants to sound so professional and, they cannot make a single mistake. And that just comes out so robotic, and you don't want that. You want someone on camera to talk very naturally and, just, with genuine emotions and genuine information. And I think people will you build your credibility much better that way.
Yeah, and I think just being authentic, right? So we're all human. We all potentially make mistakes. So I feel like that helps you to be more relatable. And then one of the other things that I typically will do is either relate the story to myself, because I am a wife and a mom and a mother. And so I think that that kind of lends itself to not just, them listening to the story because of your credibility, because you have that credential or you have that doctorate or you have that expertise, but then it also shows your human side. So I mean, for me personally, I tend to say that, right? So especially during what's going on right now with COVID-19, I'm afraid just like everyone else is. I go into my job, my clinic, my practice site, and of course, anytime I hear anybody who has a cough, like my ears perk up, and I'm very like hyper vigilant about, does that person have a mask on? How far away am I from them? So because of the fact that I have a family, like I don't want to unduly put them at harm either by potentially putting myself at risk, because right now we're having sort of a challenging time getting enough protective equipment for our healthcare workers. So, those kinds of things are definitely weighing on my mind, and bringing attention to those things. I've had a couple of recent interviews talking about the lack of PPE or personal protective equipment. And it's, near and dear to my heart, because in addition to, not maybe potentially having it for myself or having it in scarce supplies for myself, it's also my colleagues that I'm worried about, my colleagues that are working in hospital, my colleagues that are working in the pharmacies that are definitely on the front line that have like no personal protective equipment. I had a former student of mine, she posted a picture of her pharmacy staff. One of their patients had sewn fabric masks for them, for their whole staff, which I thought was amazing. And like
I think what's important there, and I think you're bringing up some great examples, what people are caring about, what people are doing, including people making these own, their own masks to help with. And that's a great story. Like from a journalist perspective, like you want to hear about that. You want to hear what someone in the community is doing to help somebody else, especially in light of something like this. So, if those things come up and it's something, it makes you kind of think like, like you said, what reporters are looking for, what kind of content they're looking for. We can find facts, we can find, things about how many cases are in Southern Nevada, for example. But it's stories like, hey, that person is doing something for this person. That is something you don't read in the newspaper. You can't find that. That's a very cool, individual, unique story. So, if you're in the healthcare profession, you're getting help with someone like that, reach out to a reporter. Like they want to hear those stories, so really kind of think outside the box in terms of what you can add. It's not just the facts, what you can get from the books, and it's your own personal story, your own personal, you're a medical professional and you're scared like the rest of us, so those are kind of the compelling stories that we're looking for in the media.
Yeah, I think that's such a great, way to kind of condense all of the information, and really just thinking to yourself, if you were the person on the other side of the television or the other side of, that media platform, what stories would you want to hear? And if you look at that and think, hey, I really wish that somebody had told me about that story, then it's probably newsworthy. And don't be afraid to contact these news reporters through things like Instagram and Facebook and Twitter. I've had several times where I've just direct messaged a couple of reporters and been like, hey, just letting you know, like I just saw this, or I'm not sure if you're aware of what's going on with this. And they're so appreciative. They're not going to be like, who are you? That a lot of times what's happened is like they'll start following me because they're like, hey, I learned stuff from you. So you want to establish yourself as that resource, so that they that they'll contact you. You may not be the one that's the focus of their story, but that's okay. If you can help them find a source, that makes you a valuable asset that they can use again in the future.
Yeah, like we're always looking for resources and for that source, you call it the news source, and Christina, I'm sure right now you've become a news source, a medical news source for a lot of the reporters out there. And we appreciate you so much because even if there's nothing going on, we'll call out, we need a story idea for today. Do you have anything happening in your world? And that's kind of good practice for any reporter out there. We've always been taught that the best news stories come from people. It doesn't come from like a press release or anything like that. It comes from individuals in your community who knows about a certain thing that's going on that might be newsworthy. So yeah, definitely do that. And don't be afraid to reach out to reporters. We're humans too. Like we're not going to bite you. We want that information. We're always looking for content. So even if we can't cover that story that you want to cover today, who knows, maybe 2 weeks later, we need content. Hey, that story's kind of important now. There's something happening in the world that relates to that pitch that you gave us 2 weeks ago. So we're going to reach back and contact you. So that consistent, keeping in touch with people in the media, build a relationship with them, network with them as much as possible. That is the way you get your information out there.
Yeah, and if you have content that you've done, make sure that you save it so that you can show the reporter what you've done in the past and any of your on-camera appearances so that they can see, what you're able to do. So that's also something that I've had an opportunity to get the benefit of, is that, I had somebody who forwarded another news story to someone else, and they made a comment of, oh, I had seen some of your other footage. And so that's why we thought it would be a good idea to have you on. And I was, So again, I feel very fortunate that because, I had the benefit of being able to work with someone like yourself, that I was very prepared when the opportunity came that I could be interviewed regarding a story that matched my expertise. So I always tease and say, I've been doing public health since before public health was cool, right? So like I've been in public health for, over 12 years and nobody cared about it, but now they care. So, you have to make sure that you're prepared for when the opportunity comes. So
yeah, and there's so many opportunities now, right? The podcast that you're doing, more and more people are getting their information through podcasts. They're listening, they're watching more than just television. They're going online and they're getting on-demand information, So you offering something like this is what people need and what people want now, especially they can't go outside and get that information. They have to stay home right now and get the information at home. So, think about ways that you can be useful to your community, whatever you can do to help your community and give back. I think that can really come back to you tenfold.
Absolutely. All right. Well, thank you so much, Petrania, for everything that you've done for our community as well. I know that, you've had such amazing opportunities to do breaking news stories, and you have been on the forefront and the face of, factual and credible information to the public. So thank you for that. And thank you for being such a great example. I hope to be able to just have like a 10th of your knowledge and your expertise. I'm not a journalist by any means, but I do feel very strongly that unless the healthcare profession starts doing more media contributing, the message is going to be crafted by somebody else, and it's potentially going to be inaccurate. And so we need to do a better job of getting out there and getting in front of the public, because as you can see right now, the example of COVID-19, all of this misinformation is why you've got kids out on the beach at spring break because there's no consistent messaging. And when everybody else is sacrificing and at home, you still have crazy people out there saying, I'm going to live my best life. And they're like, I don't care about the virus, because they keep getting different information from different sources, one saying it's super serious and the other one saying it's not that big of a deal. So that's why messaging and consistent public health messaging is so important for the good of everyone and for the good of our communities.
All right. Well, I need that too. So thank you so much for all the information you're putting out there, Christina.